Here I've just laid out some key points in which this presentation focuses on.
Hi, my name is Brooke Flanagan. I'm a first-year paramedicine student currently studying at the University of Tasmania on the Rozelle campus. Throughout this presentation, I will cover Dr. Shimena L et al.'s 2021's secondary analysis of the STAMP trial. The trial sought to determine the effectiveness and safety of tranexamic acid in the pre-hospital environment. This secondary analysis aimed to fill in the gaps of this trial by determining the optimal timing for administration of tranexamic acid to injured patients and its outcome benefits. So what is tranexamic acid? Brenner et al. 2019 explains TXA as a synthetic drug used to prevent excessive blood loss. It does this by preventing the breakdown of blood clots. Kinda like when beavers build their dams. They use sticks to plug the gaps so water doesn't flood out. Well, in our circumstance, the water is our blood and the beavers are TXA. So why is this so important? Well, excessive blood loss is a leading cause of preventable deaths among all injured patients, with almost 2 million people a year dying from it. That's about the population of Nebraska. The ACEP states that the prevalence of these injuries contributes approximately 40% of all trauma mortalities. So, essentially, TXA has the potential to save many lives. However, there is a twist to the administration of this drug. So why was this secondary analysis conducted? Well, as I've mentioned earlier, TXA can be very beneficial in reducing mortality rates in hemorrhage injuries. However, there is a time frame in which this drug is the most beneficial. Dr. Shimena et al. 2021's secondary analysis sought to characterize this time frame by comparing early versus delayed administrations of TXA. This was needed in order to further analyze the results of the STAMP trial and to determine if the administration time of TXA makes a difference. For example, the results of the STAMP trial concluded that tranexamic acid given to injured patients at risk of hemorrhage in the pre-hospital setting is safe and associated with survival benefit. With this piece of evidence not telling us a whole lot about the appropriate time frame and specific benefits of this drug, a driving factor for this secondary analysis was constructed. So what is the context of this secondary analysis in the field? Well, the CRASH-2 trial states that if TXA reduces death due to bleeding in trauma patients, this would be an important discovery. Within this secondary analysis, the results demonstrate that those patients who received pre-hospital TXA within an hour of injury displayed a 65% lower risk for 30-day mortality, whereas late administrations did not. In addition, this study shows that patients in shock or at significant risks for hemorrhaging would benefit the most from early TXA administration. This analysis is relevant in the pre-hospital setting as it puts a more specific focus on the role that time plays when it comes to the administration of TXA. With these findings, emergency responders can be better equipped to identify when TXA is most useful and which patients may need it. What were the gaps in evidence that existed when this trial was conducted? Well, within this analysis, the dose of TXA is set to 1 gram in both pre-hospital and in-hospital settings. Dr. Shimena L stated that this dosing regimen was used to keep it consistent with existing literature. However, this dosing regimen has been questioned as newer studies have shown that higher doses of TXA could provide more beneficial outcomes. For example, Shi 2022 randomized clinical trial produced evidence that a higher dose in comparison to a lower dose of TXA is associated with reduced needs for red blood cell transfusions. Two of the main trials that led to this analysis included the STAMP trial, in which this analysis was based off, and the CRASH-2 trial. The STAMP trial gave the authors of this secondary analysis an insight into the effectiveness of TXA in the pre-hospital setting. Additionally, the CRASH-2 trial is the most significant study of TXA.